Hello everyone. I am Thelma and welcome to Convos with Thelma. Hey everyone, welcome back. And today we have something very exciting. We have something I am calling do's and don'ts of pre-med students who are hoping to go into medical school. Hopefully it applies to other professions as well, but I am doing it specifically for pre-medical students. So let's get into it. Okay, so I'm gonna start with do's, and I have it here, so I'm going to be looking down on it, just if you see me, glaring down a little. So the first one for our do's is one, get a job. Okay, get a job. Hopefully in the medical field you can be a nursing assistant, a nursing aide, a medical assistant. You could work with the vulnerable population, hopefully in the medical field, so that would also count as an experience for you, and it will also give you a little bit more insight into the medical system, into how the work flows, and if really that is a place you want to be. I personally worked as a nursing assistant in a nursing home, that counts, in a hospital as well, so that will be of benefit to you regardless, but any kind of job also helps, because who doesn't want money? Okay, even if it's a weekend job, because also what mostly you were doing. The second one I would say, I think I have about 5, but it can go over. The second one I would say is volunteer. Okay, do some volunteering with your community, with your church, other places you feel like you'd be able to help out. So I personally applied to be a volunteer at a hospital. I really started on the floors, like, helping patients out with getting them water and things like that, and I went to the emergency room. Besides that, you can really volunteer with your church group. So I was an executive of my church youth group for a while, and we did some volunteering with vulnerable populations, with Habitat for Humanity, Faith Missions. There are a lot of volunteering opportunities that you can search for. If you have like a food bank, like a homeless shelter within your area, it doesn't have to be like every week go volunteer. Mine was, I think, bi-weekly with the hospital ones, and I did it for a few years. Start early so that you'll be able to get a lot more experience with that, but it could be once every 3 months, once every 6 months. Just get those volunteering opportunities. The third one I would say is shadow. If you're able to get the opportunity to shadow a physician, a nursing practitioner, shadow a physical therapist, a pharmacist, if you're able to shadow physicians in different areas of specialty, that would be awesome. The third one is talk to people who have had similar experiences. If you know people who have had similar experiences, it's harder to say than doing it, because if you don't know anybody within your community, or if you don't know anybody who has had that experience, if you don't know anyone who has gone to medical school, gone to pharmacy school, you really have had to just do that by you just have to write it through, and hopefully you figure it out yourself. But if you do know people who have gone to medical school, who have gone to pharmacy school, who've gone to physical therapy, respiratory therapist school, whatever, talk to them and see if that's what you really want to do. They'll tell you the highs and lows, the things that you should be hoping for, the things that you should be doing, as a high school student, as a undergrad student, and even as a medical student. Talk to people with similar backgrounds as well, because sometimes most people within the medical community, I would say, are from privileged backgrounds, and they do not have similar experiences like I would have had, or they do not have experiences that you feel like you may be able to relate to. The last one, not last one, but the next one will be find a hobby. Do something that is outside of school. Do some extracurricular activity. If you can play the piano, continue playing the piano. If you like to exercise, if you like to sew, if you like to do makeup, hair, continue to do that. The fact that you want to go to medical school does not mean, or you want to go to a professional school, does not mean you should ignore all those sides and just focus on medical school. Granted, you should focus on that, but also you should do things outside of it. And when it comes to time where you're interviewing for medical school or for any professional school, if an interview is needed, all those are like talking points for you in the future. As for medical school, if you're able to, do get some research experience. I didn't have any research experience while going into medical school, but it certainly helps. I really do not have, a very strong opinion on that. Obviously not everybody has the chance to, but I didn't have any in medical school, prior to medical school. And the last one that I would say, if you had to take any other class that is not really a prerequisite to medical school, like the biology, organic chemistry, the physics, if you have to take any class, if you wanted to take dance but you feel like you need something that will also be beneficial for you in medical school, please take anatomy and physiology. You will see it everywhere. Obviously anatomy, that's the human body, physiology is how it works. So take anatomy and physiology, even if it's an introductory class to it. Take it is going to make your transition into medical school or even to to PA, physician assistant school, way better. Physical therapy, I guess. So for the don'ts, the first one on it is don't listen to the haters. If that's a big thing. Don't listen to the haters, because there are so many people who are going to tell you that is a long journey, and they will not be lying. But if it's something that you have set your mind on, it's something that you have been working towards on, don't listen to them. Everything comes with challenges. Even if you decide to be a tattoo artist, it has its challenges. The second one is don't overdo it. I think especially as a pre-med student, you're tempted to do all the classes, tempted to do the difficult classes, like even if it's not a prerequisite, like I need to do it to be able to be better, I need to be able to take this class, I need to do a double major, I need to do a major and a minor. Like you don't have to do all that to be able to be a very strong candidate for medical school. Do the things that you're required to do and put in extra effort, but don't burn yourself out, because medical school is there to do that for you. Or professional school, pharmacy school, whatever, is there to burn you out. So don't do it before you even get there. The third one I would say is maybe this is not really a don't, but you don't have to get all A's in your classes before you can go into medical school, but don't ignore the scores. The scores are very important. I guess the more A's you get, the higher your GPA and the more chances you're able to, or the less easier your processes. But the fact that you have a couple of B's, even a C, does not preclude you or does not remove you from the equation. You're still able to go to medical school and succeed. So you don't have to get all A's, but still strive to get a lot of A's, if not all. Next one is don't forget your personal connections, the friends that you have right now, or the family you're bonding with, the people that are around you, your community. Don't forget them in that journey, because when you're in school or in medical school, in a professional school, that you're going to get tired. Those are the people who are going to re-energize you. Those are the people you're going to come back for, to rejuvenate you, to encourage you, to motivate you, to continue to push you. So if along the way you're pushing them away because you want to solely focus on school and be right there study, if that's all you want to do, they'll come to a point where you need them, not because you feel like you're not able to study, but because you need people around you to be able to keep you sane, especially for most professional schools. The last one I have on the don'ts is don't give up. I can tell you that because there were so many instances that I wanted to give up, but don't give up. It is a very long journey. Don't forget your why. There are so many reasons why people go into different fields of careers. Medicine is kind of like a special one because it's such a long journey, it's such a tiring journey. It can be very individualistic as well. So don't forget your why and don't give up. So those are just a few things to do, some don'ts for mostly people or for students who are trying to go into medical school or professional school, mostly undergrad, high school students. But maybe we could do some don'ts for medical students, people who are actually going through it, because you go through it. Okay, so thank you guys for listening, and let me know if you have any questions. Please do like, share, comment, subscribe. Please subscribe. We're here to stay. But let me know if you do have any questions, and I'll be glad to answer them. It's been a pleasure as always, and thank you for being here. Thank you for hanging. Bye.